And tonight I'll be talking about possible reasons why IVF could fail. Tonight I'll be talking about possible reasons why IVF could fail. This is Dr. J at Ask the Gynecologist. I'm hoping my audio is very good. If my audio is not good, let me know so I can change things. I know it's a bit late at night. Most people are probably on their way home or to bed. But never mind. If you're free, you can join me. Or if you're watching this video as a recorded version, that's fine. You can still learn a lot by the time you're watching it in the morning. Once again, I'm Dr. J at Ask the Gynecologist. It's a wonderful start to the week. Over the weekend, we had our May seminar, and most people that attended the seminar, they really enjoyed the seminar because I went into full details on how you can maximize and you can increase your chances of success in IVF. Now, this discussion tonight is still about possible reasons why IVF could fail. But this topic today is not for only those trying for IVF, it's for everyone. You never know what you'll learn. You never know what you're going to pick up today and how your life could be changed. I was having a discussion with one of our Diamond members, subscribers today, and this lady, she's had, I think about 5 failed IVF. She's had hysteroscopy, she's had myomectomy, and still yet nothing's happening. Husband's sperm count is good. She's done everything she can do. She's given me some of her results, and still yet she's saying, what can she do? And I'm very sure this lady's story is similar to other people's story listening to me today. And if this is your story, if this is a story that is familiar to you, and you know somebody that has gone through this kind of challenge, probably this discussion today will be an answer to their quest, will be an answer to their concern. So everyone, once again, I want to say good evening. Before I keep talking, before I start talking, I want to check, is my audio good? If you can listen to me well, if you can hear me well, please give me some thumbs up on your screenshot. If you're on Instagram, if you can hear me well, give me some thumbs up. If you are on Facebook, if you can hear me well, give me some thumbs up. I can already see few of our moderators out there, and Elizabeth and Christina, thank you guys. You're wonderful and you're amazing. And we're going to talk about this topic tonight. I'm going to talk about a few things that could make IVF fail. Thank you, Charles Okachukuma, for giving me that answer there. And Adebeki Sylvia Okonkwo, Injidelfo, Ifeoma, Judith, Usman Ogonugwa. If I've mentioned your name, welcome once again to the show. If I've missed your name, I'm sorry, it's not intentional. I just want to quickly catch some few names so that I'll talk before people go to bed. I know it's a bit late, and I'm sorry to come at your face so late tonight. Most importantly, I want to say good evening to you. My name is Dr. J at Ask the Gynecologist. And if you are saying, what is all this thing about Ask the Gynecologist? My sister, my brother, I want to tell you something. You see, Facebook has gone ablaze, and we are coming at you with every way. ATG is the #1 resource by the grace of God on Facebook today, where you can learn a lot regarding your female fertility concern. Most things on Facebook here, on our page, we'll talk in detail from licensed sources, from reliable sources. I and Dr. Esther and all our moderators here will guide you accordingly for you to reach where you need to be on your journey to getting pregnant. So if you wonder what is all this Facebook thing on ATG, we are Ask the Gynecologist, and we talk about female gynecology issues. Thank you, Bakari Pedro. I can see your comment there. Thank you so much. And I pray that God Almighty will keep looking after the young one, and not only the young one, for myself and my wife, but also we bless and look after the young ones that people have been able to bear over the last few months, and even those ones that are still on their way. God will keep blessing them, will give you all experience, the power and the grace to look after them and to make their life better in this world so that they can be of value to the world at large and even to themselves. So that is my prayer. I can see Chinenye Anya Wezim as well. She's already on. And so that my prayer is that every baby we've celebrated this May will be children of blessing, and they're going to bring joy to homes. And God will give us the parents, ability to look after them and to make their lives better until they can make the world a better place by the grace of God. So without too much wasting of time, let us crack. Okay, now the #1 reason why IVF fails, everybody knows that already. is age. Age is a big factor. Age. And we talked about this over the seminar over the weekend. Age has issues with your eggs. The important thing is that once you cross that age 40, the amount of eggs you carry starts to fall in terms of quantity and quality. Quantity and quality. Number. See, once a baby is born, the amount of eggs you have all life is already being deposited. As you get older, the amount of eggs starts to fall. Once you get to that 40 years old, that's usually the threshold point, the amount of eggs start to fall fast. Okay, so sometimes we can't predict it. Fall so fast. Not only the number of the eggs, but the quality too will fall. So I'm not saying that if you're above 40, you can't get pregnant, but the chances of success starts to fall. Most importantly, if you're going for IVF at age 40 and above, usually once you get to that 44 and above, the quality of eggs that you produce is not very good. So if you're above 44, you're going for IVF, the chances of success using your own eggs starts to drop astronomically. And only 2% of people over 44 using their own eggs for IVF will be successful. That's the honest truth. It's statistics. It's not me. It's just a fact. Now, people will worry, if I use the egg of somebody else, donor egg, what are the issues? Is she going to come after me to get my baby? No, there are legal documentations. Definitely, if you're using donor egg, that donor egg is not your child genetically, but it's your child legally. And it doesn't matter whether a baby is genetically yours or legally yours. The most important thing is that, are you able to show love to that baby? If you're able to show love to that baby, your legal child, then you're a wonderful parent. So people worry that, the baby will be my husband genetics. He or she won't be my own genes. It doesn't matter. Once you've taken that donor egg, it's yours legally, okay? And there are documents you sign to receive the egg. You can't say, because now I have the baby, maybe the baby has problem, I'll give the baby back. Once you've taken the egg, we do some genetic screening, ensuring baby is fine, and ensuring the genes of the baby is fine before we transfer the egg into you. Before we get a donor, we go through information about the donor, the health of the donor, so that the person is totally screened and acceptable to you before we go ahead. But you don't know the donor. The donor of the egg does not know you. We match them, you match you, and all the tests are good. There's no transmissible diseases involved. You get your egg, it's your child, it's your baby. So many women are able to get pregnant using donor eggs today in Nigeria, and they're happy. They won't tell you because they've moved on. So if you're age 44 and above, chances of success using your own egg is 2% in IVF. So if you're age 44 and above, we've done your AMH. AMH is a test we do, AMH, anti-Mullerian hormone. AMH, that's a test we do to check the quality and the quantity, basically quality and also your ovarian reserve. Once we've done this test, and if the tests are not very promising, it's not very good, then we have to consider egg donor. Sometimes even we stimulate you at around that age, we harvest your eggs, okay, and then we put the egg, fertilize with sperm, and we watch for development over about 6 days in laboratory to see if the eggs are developing well and they are forming that what we call blastocyst and all that. And if the eggs looks good, developing well, they will now transfer back into you. In most cases, we get about 2 or 3 eggs developing well in the laboratory before transfer. But if the eggs are not developing well in the laboratory, then we have to cancel that cycle. In most cases, we have to move on to consider egg donor, if that is the case. I'm not saying that if you're above 44, you can't get pregnant. I'm only saying that chances of you getting pregnant using your own eggs is quite on the low side. So that's number one, age. Age is always a factor. Age, time is always a factor in everything we do in this world. I'm hoping you can hear me well on Instagram. Now, if you have any questions, leave the questions, okay? And let's quickly have a discussion. Then we'll go back to the questions shortly, okay? Number 2, infections. Infections, sometimes bacterial vaginosis hiding quietly in your vagina at the time of transfer. That is why before we do transfer, we do vaginal swabs to check for any infection, anything disturbing that could affect the environment before we transfer the egg. Okay. Number 3, your womb. Okay. It's essential before you go for IVF that we scan you. And what are we looking for on scan? I was talking to a lady today. I won't tell you where she was, but she's based in Europe here. And this lady, amazingly, she's got pregnant. I don't know how she got pregnant. Let me explain to you what a womb looks like. So now, this is Let me see if everybody can see me. So now this is this lady's womb. Now it's going to be a small diagram because I want to keep all these things on the screen as I explain. Now this lady, this is the normal womb, okay? This is a normal womb, okay? And this is what every woman has, okay? Normal womb, okay? Okay? But this lady, her own womb is totally distorted. Now, the womb is like this. It's two cavity womb, biconate. Okay? Okay? So, this lady, her womb is like this, okay? And apart from that, she also has multiple fibroids. Fibroid there, fibroid here, another fibroid in front here. So she's got 3 fibroids there, okay? The reason why we need to do scan before we do IVF is that we want to know if there's any abnormality in your womb. Now, this lady, a womb distorted like this, okay? The pregnancy will not have enough space to grow. So the pregnancy is here. It won't have enough space to grow because it's just that the womb is not comfortable for her, for the baby. And the other side of the womb, this other part, number 2, is very, very shrunken. Pregnancy cannot really stay there. So pregnancy stays here. She got fibroids, also adding to distortion of the womb cavity. This lady, I don't know how she got pregnant last year. She had a baby last year. She had a CS to deliver though, but in the first instance, how she got pregnant is still a mystery to me. That is where God comes in. Okay, now there's nothing God cannot do, but my job as doctor is to show you that these things are important in getting pregnant, that we should treat them. So this lady, she's got this. She had a fibroid removed about 2 or 3 years ago. Still here, she still got 3 fibroids there. So I spoke to her. First of all, I don't know how you got pregnant last year. It's still a miracle to me. However, in this case, I'll suggest we leave this alone and you get pregnant naturally. Now, we go for scan before you get pregnant because we want to know if there's stuff like this in your womb. In such a case like this, I'll suggest that we take out this fibroid first. Take out the fibroids, and then go through hysteroscopy, a camera into your womb cavity, and take away, if possible, this septa in the womb. If we can. If we can't, we leave it alone, or we take as much as we can safely. That is hysteroscopy. So if we see any abnormalities like this in your womb, like distortion, abnormality in your womb, we have to take them out. That's number 1. What can your womb do again? Some people, they've had D&C before. Fibroids removed from the womb cavity. Fibroids could be in different places in your womb. I always explain that. Fibroids could be outside like this. It could be so fibroid could be outside your womb like that. It could be within the wall of your womb like that, or it could be in the cavity of your womb like that. Okay, you see what I mean? So some people, they've had fibroids in the womb cavity, inside the womb. Fibroids in your womb cavity like this one, okay, can only be taken out through hysteroscopy. These ones can be taken out through open surgery or keyhole surgery and stuff like that. But this fibroid in your womb cavity, taken out through hysteroscopy, sometimes after hysteroscopy, what we call operative hysteroscopy, maybe to remove fibroids, or maybe if you had severe infection before in your womb cavity, or if you had D&C in your womb cavity before, it can make you have scar tissue in your womb. And if you have scar tissue in your womb, this is how your womb is. It's going to be distorted. There will be scar tissue, like tight cobwebs in your womb. It will distort, affect pregnancy from implanting. In such a case, before you go for IVF, we scan you, we do all sorts of tests, we see this kind of suspicion, we go in through hysteroscopy to resect and take out all this scar tissue in your womb so that your womb cavity can be totally empty as it's supposed to be, to allow a pregnancy to grow when you get pregnant. So we take out the scar tissue in your womb like that, and your womb is open like that. We do that, we call that hysteroscopy resection. Hysteroscopic resection of uterine syneke, okay? That is scar tissue, syneke. I know a lot of Nigerians know about that now. Everybody know about scar tissue, uterine, synecdoche in the womb cavity, like cobwebs in the womb. We take it out on hysteroscopy before you go for IVF. Another thing that could affect people will now wonder, okay, if all this is okay, everything is fine, I don't have all these kind of issues, why do I still have a miscarriage, or why do pregnancy not go for me? They think, some people will tell me, oh, I was told that my cervix was too tight, so therefore they couldn't get the catheter in during the transfer. That can happen, true. So, but what does a tight cervix mean? Okay, I call that cervical stenosis. Cervical stenosis. For the spelling, I'm going to write it on the screen. Excuse me. So, cervical stenosis, Cervical stenosis, Stenosis, cervical stenosis. That is a tight cervix. Let's people on Facebook here see what I'm writing here. So that is a tight cervix. Sometimes you go for the IVF, we put in the catheter into your womb cavity to transfer the eggs back into you. This can happen that your cervix is so tight and we can't navigate through into your womb cavity. In such a case, what we do is to dilate your womb cavity with a gentle uterine sound. And sometimes it's so difficult, we abandon the procedure. In such a case, you might need what we call hysteroscopy again to dilate your cervix so that we can try again at the next cycle. In such a case, what we can do is to cancel that cycle and then save that hex for you and then try again. That can happen. What will make a cervix too tight? First of all, if you've never been pregnant before, your cervix will be tight. It's normal. It's natural. The cervix is designed like that to be tight and closed as far as you're not in labor. So if you're not in labor, you're not having a baby, your cervix is closed. It's natural. Sometimes, if you've never had a baby before, cervix can be so tight as well and be a concern for people. What we can do is to bring you pre the IVF transfer, examine you, and see and try and dilate your cervix gently to make sure that it's open and easier for us to put a catheter in during the egg transfer and make it easier for us. In some rare circumstances, if we cannot dilate your cervix on the day of the transfer, option could be to sedate you lightly with a light sedative so that we can easily maneuver and gently dilate your cervix and push the egg inside. Another reason why IVF could fail is during the transfer, some people will scan them or some people are not scanned. The reason of scanning you on the day of transfer is to check for fluid collection in your womb cavity. And what are we looking for? Let me explain this to you. We are still on number 3, the womb. Okay, so now, if you're just joining us, I'm Dr. Alalade, one of your doctors here at AsktheGynaecologist. So this is your womb, okay? The womb is like that, like a pear-shaped structure, okay? And that's your cervix there. Okay? Okay, let us draw this properly now. Sorry. Okay, good, excellent. So that is your womb. Okay, now so this is the wall of your womb. The wall of your womb, that is the muscle. I'm going to paint in red. Okay, for this purpose only, red. So the womb is red because it's full of what we call endometrial fibers, smooth muscles, myometrium. That is the muscle of the womb. Okay, they are all what we call smooth muscles. They contract without our control, autonomic supply by the power of God. Okay, so that is your womb muscle. Okay, now before the transfer, okay, during the transfer, we put in a catheter. The catheter is I'll put the catheter as a blue color. So we put in the catheter from your cervix there. Okay, that catheter go in there, and then we dump the egg there. Okay, it attaches there and it starts to grow. Before we do that, okay, we should scan you. And what are we scanning for? We're checking for fluid in this area. If there's water there, fluid, what we call endometrial fluid, is not supposed to be there. We try and suck them out before we put in the egg on the day of transfer. Okay, if it's too much, we can suck it out. We abandon the procedure, because if we transfer the egg with fluid in the womb cavity, it will probably not implant, to detach, and there will be miscarriage or there will be failed transfer. So it's important you get scanned on that day of scan before the transfer to check if there's fluid in the womb cavity. Another thing we check on the day of transfer is that we check the endometrial thickness. Okay, I'll call it endometrial thickness. Something is thick. Okay, it's like you when you want to lie down on the bed to sleep, you want to make sure your bed sheet is very, very clean. If you're in a cold winter, you want to have a thick duvet to keep you cool, to keep you warm and comfortable. The same thing too on the day of the transfer. What we want to do, we want to scan you to check this layer of the womb. You see this black layer of the womb? We want to check it, whether it's thick enough and ready to receive the egg. So we check this thick layer of the womb here. We call it endometrial thickness. So when you scan it, that is the womb cavity. We're checking this layer, okay? Okay, so we measure from here to here to check the thickness. You see that thing there? This is it here. We check the thickness of the womb. Okay, so that is your womb muscle again. So we're checking this thickness of the womb. These things are very, very crucial before we transfer egg into you. We must check them. If they're not checked properly, if they're not checked when it's supposed to be checked, eggs transfer could fail. Okay, they could fail. Another reason why transfers fail, another reason why IVFs fail is chromosomal abnormalities. Okay, now I know as people get older, they want to go for transfer. There's a risk that the egg being transferred or the pregnancy can result to a baby that has some syndromic problem, chromosomal abnormalities, genetic problems that are incompatible with life. Incompatible with life means that they are not suitable for life and the baby will miscarry. Now you say, why don't we do some tests on the pregnancy, on the baby, on the fertilized egg before it is transferred? Some tests can be done, but in summary, we can't test everything. And if you want to test everything, it costs a lot. Probably it's going to defeat the whole total cost of the IVF. Some parents will say, okay, fine, I don't care. The baby has problem. I'll look after it. Give it to me. So sometimes before we do all these tests, we have to take consent from you that you are happy, because it's not good to know something and you can't do something about it. Okay, so we can do tests, but they'll be very expensive. So you have to know that. And some tests cannot determine what the gene reassortment will result into. So the tests do have limitations, and some tests cannot be totally relied upon. That is the honest truth. So these things can result into miscarriage. Another thing that can cause failed IVF transfers, failed IVF, is failure to implant, failed implantation. Now, why would that happen? Reasons could be fluid in the womb cavity. Reasons could be the womb is not thick enough. Sometimes reasons could be low progesterone. That is why after IVF transfer, you should be given cyclogest as a kind of a progesterone support to encourage and reduce the rate of pregnancy loss. I'm hoping you already know by now. If you're going for IVF anyway, you should and you must be on folic acid at least 3 months before you go for IVF. So if you're trying to get pregnant, you're going for IVF, you should be on folic acid at least 3 months before pregnancy. Worst case scenario, at least 1 month before pregnancy. Because if you're not having adequate folic acid, it could result in maybe having neural tube defects or brain problems. And sometimes nature will say this baby is not compatible and the IVF could fail. So these are the reasons I'll give today that can result into failed IVF. Now I'll take questions, okay? I know there are more reasons, but I can't go through everything in one single sitting like this. So I'll answer questions now, and then we close the discussion for tonight. Okay? Thank you once more. Now I got people on Instagram here. I got people on Facebook, and we're also recording for YouTube as well. So let us scroll down and see questions. Thank you, Christina there. Chimenka, thank God, Ibe. She's saying last year I had a uterine surgery for fibroid twice, and next week I will be doing laparoscopy for ovarian cysts before continuing my 10 days progesterone IVF. Well done. So keep faith, keep praying, and it shall go well with you. I got a question here on Instagram. Doctor, please, what is the rate of success for one that would like to do PGD in your laboratory, and how does it work? Okay, so if you rate of success for IVF is about 40% to 50%. Success rate of you want to do PGD test is not a successful thing or not successful thing. The test for PGD is pediatric diagnosis. They are tests, okay, and they'll give us answer. It's not about success or not. PGD test is PGD test. We do all the tests you want and we give you the result. That's PGD. But IVF success is about 40 to 50% based on the statistics of the doctors that are working with us in IVF at the ATG IVF Center. Okay, 32-year-old unexplained infertility, going for IVF, success rates about 40 to 50%. Okay, that's on Instagram there. Now we are back on Facebook. Benedicta Basoje, thank you. Thank you, Lily, for putting the address here on Instagram. What is the right something? I can't see that. It's gone. Let's go back to Facebook here. Somebody's saying that what is the right time for IVF after fibroid surgery? Allow your fibroid scar to heal at least 6 weeks. Then you can start going for IVF after total healing. Doctor, please, what can I do to stop gathering of fluid in the womb? There's nothing you can really do. What you can really do is that if you notice any offensive discharge, get vaginal swabs done and get treated as soon as possible. Okay? Other than that, there's nothing else you can really do. Okay? Good. That is for Grace Uchechuku Uzoma. Thank you, Grace. Emu Collins Onyeka, thank you so much for your comment. I really appreciate it. God bless you and love you so much. Let's see other questions here. Somebody's asking a question. Blessing Osemwe, I've answered your question. Blessing, I've already answered your question. Somebody's saying, is there anything associated with sperm? No. As far as the sperm is of good quality, yes, true, sperm could affect. If the sperm is not of good quality, that can cause miscarriage. But if the sperm is not good, you probably not get the egg pregnant anyway. Okay, and if you go for IVF, before we put the sperm into you, we'll have checked the sperm anyway. So sperm factors are actually very, very insignificant when you go to IVF per se, except the sperm has problem and we are doing ICSI. Okay, but if the sperm is okay, good quality, moving well, it doesn't affect the IVF significantly compared to the egg factors. Okay, doctor, you're 25 weeks pregnant, your baby is longitudinal position. What can you do? Nothing else. Your baby is in a good position. Your baby is 25 weeks. Babies 25 weeks pregnant, they keep moving like the ants of a clock. In pregnancy, in the womb, babies keep moving like the ants of a clock, like clothes in the washing machine. Babies keep turning around like they are playing, like doing Jangrova. They are turning around like clothes in the washing machine. So your baby could be head down this morning, it could be bumped down tonight, it could be head down tomorrow morning. It doesn't matter. Once you get to 36, 37 weeks and above, your baby, in most cases, almost 90% of babies will be head down. Okay, so baby can be head up, head down until 36, 37 weeks. Okay, so you're 25 weeks, your baby is okay. Okay, Asha Young, God bless you. Doctor, can a woman have fibroid and yet? I can't see that. I lost that question. Sorry, I lost that question on Facebook. It's so fast. Doctor, is it possible for a couple to go for IVF when the man morphology is poor and the woman has PCOS? Yes, Francisca Bobby. Yes, that is true. You can go for IVF. You said something about chromosomal abnormality. What can cause it? We don't know. That is where God comes in. Chinonye, chromosomal abnormality is when the genes from mommy and daddy are mixing together and there's any disagreement one way or the other, or the genes are not arranging and rearranging. What they have to rearrange. You see, when you get pregnant, the cells that will form the hair will form the hair. The one that will form the head will form the head, brain will form the brain. So they're always moving around the genes, so that, and sometimes there can be mistake. So there's no way any scientist can go and prevent such mistake. That is where God comes in, and that's where prayer have to come in. So for such, there's no way you can prevent chromosomal problems. But what you can do is that before we do the transfer, okay, we can do some tests, okay, to see if there's any problem before we transfer it, okay. But those tests will come at a separate fee. They're expensive, to be honest. That is the truth there. Thank you for Alalade Oji. Thank you, Ngaya Chinonye. God bless you. Okay, let's take some questions here on Instagram. Okay, Okiere 6515 is saying, is it necessary to remove fibroid outside the womb before IVF? If the fibroid is less than 5 to 10 centimeters, it's not causing you problem, leave it alone. Okay, so if you're going for IVF, the fibroid is less than 5 centimeters, usually we leave it alone. Okay, but if you have multiple fibroid, about 3 or 4 fibroid, 2 fibroid, 5 centimeters, each of them, that will be significant. I think you should remove that before the IVF. Okay, doctor, your ovulation is becoming painful. Should you get worried? Do a scan. During your ovulation time, do a scan so we can check your ovaries, okay? And then we know what's happening. Doctor, can we operate endometriosis? You're having serious menstrual cramp. You can't endure it. If you have endometriosis, what we need to do is to do a scan. Definitely we won't see endometriosis on scan, but we'll see if you have a cyst or any other problem on scan. If we're happy that there's no other cyst on scan, at least we know. Before we open it up, we are prepared. And then we go in through keyhole surgery, that is through laparoscopy, and then we go and check your tummy, we check your tubes, we check your ovaries, we check your womb, your bowels for any sign of endometriosis, and then if there is, we destroy them. Okay. Now, Fumikoka is asking, what causes failed fertilization? Fumikoka, the whole topic today is about what causes failure of IVF. So I've explained the whole thing on this video. So watch the video over again, and you see one of the reasons why there could be failure of failed IVF. So everything I've said here today, about 30 minutes now, is about what could cause failure. Failed IVF. So watch the video over again, okay? And Fumikoka, God bless you. Thank you, Teminda. You're always showing Iloido. Acupuncture help in IVF. Acupuncture is good. I don't know much about it. You know, my medical training, I don't really know much about acupuncture. Maybe I'll read about them in future, but for now, I'm not skilled in acupuncture. I don't know its maximum effect or its possible effects with IVF. So, but if you know about it, you'll feel safe with it. See a professional about it, and a professional will take you through, guide you about acupuncture. But I don't know about it. Okay. Can uterine myoma cause miscarriage? Intramural myoma is basically fibroid, okay? Intramural myoma, adamazli, is fibroid in the wall of the womb. So you have fibroid in the wall of the womb, okay? It's unlikely to cause miscarriage. Doctor, can someone who did hydrotubation in January still do laparoscopy? Yes, you can. Very good, you can. Is it compulsory to remove fibroid before IVF? Priska, not, you don't have to. But if your fibroid, it's in the womb cavity. If fibroid is in the womb cavity, okay, in most cases you remove them before IVF. But if fibroid is outside the womb, or in the wall of the womb, usually we leave it alone. But if your fibroid is in the womb cavity, we'll remove it best thing before the IVF. Okay, you can conceive with adenomyosis. Okay, you can conceive. Sarah Wadia, you can conceive with adenomyosis. Can BTL be undone? Very, very difficult. BTL is bilateral tubal ligation. BTL means that you've blocked your tubes intentionally. So you block the tubes intentionally because you don't want to get pregnant again. That is BTL, bilateral tubal ligation. In most cases, to rejoin the tubes, we have to do it through microscopic surgery techniques. And it's very expensive, difficult to do, but it's doable, but the guarantee of success is very low. Okay, so once you've gone for BTL to block your tubes, you made up your mind you don't want to get pregnant again. Grace Uchechuku, I've already answered your question already. Let other people answer their question. Okay, Grace Uchechuku, I've answered your question. Let other people ask questions too. Is it compulsory to drain endometriosis before IVF? Yes. If you have endometriosis on your ovary, that is endometrioma, you should get it removed, drained before going for IVF. Yes, it is true. Doctor, is it normal not to ovulate 2 months consecutively when you're ovulating constantly? If you're not ovulating 2 months, how do you know you're not ovulating? You think maybe because you're not having a regular pain, you're not having all this regular or cervical discharge, that means you're not ovulating? It might be wrong. You might be ovulating still yet, and you're not seeing all those things. How do you know you're not ovulating? Do your day 21 progesterone. If you've done day 21 progesterone and it's more than 20, you're probably ovulating. And if your period is very regular, you're probably ovulating, okay? After prolactin medication, is it possible to miss your period? It's possible, because you might be pregnant. That is for Iju Ezioke. Thank you. Somebody's asking a question. I've missed that again. I've missed that question. It's so fast on the screen here. Okay. Anyhow, let's continue. We scroll down here on Instagram. FSH 10, LH2, prolactin 18. It's okay. Very good normal result. Don't put your result here though. It's not good. It's not private. Okay. What can one try to conceive after? Okay. If you've had a miscarriage, you had a DNC, you want to try for pregnancy again, give yourself at least 4 to 5 weeks for your period to restart again. Okay, some people, their period will start as soon as possible. But as far as you're mentally okay and you're mentally healed, you're stable, you're in that your nice position, you feel comfortable, you feel like trying again, and you have family support, anytime it's okay to start. There's no start in 1 year, start in 2 years. No. Anytime you feel like starting, you feel comfortable and you feel mentally healed, you feel physically healed, then start trying. There's no particular time, okay? But give yourself at least 4 to 6 weeks, okay? In most cases, even 4 weeks is enough, okay? But it's up to you. Get yourself psychologically healed, medically, physically healed, mentally healed before you start again, okay? How do I get tests done with you? Very easy. Just go to our laboratory. We have an ATG laboratory, and the lab address is already on the screen. If you go to our laboratory, like I said all the time, you just having your fertility test done at the ATG laboratory, including your ultrasound scan, you are automatically allowed to send your results to me and I'll review them. But when I'm reviewing your result, please follow my instruction. People, sometimes you go to their result, you tell them what they should do, they don't want to hear. It's common with us. I know. We like thinking we know better than the doctor. We are Nigerians, I understand that. But if you want to get free consultation, the best thing you can do is join our premium services. But if you don't want that, just go to our ATG Laboratories, talk to Nike, and do all the fertility tests. She'll tell you what test to do, hormonal profile, what sperm test to do, and what scan to do. And then you give me all, and Nike will tell you how you can send all the results to me, and I will review them for you. But the catch is that you must go and do the test at our laboratory, and then once you do the test there, then I'm obliged. I'm a doctor. I have to review your results. So that is that. But the laboratory is only in Lagos. Okay. However, if you don't live in Lagos, you're not close to Lagos, you can go to any reputable lab, anywhere you are, Benin, Port Harcourt, Abuja, Kano, anywhere. Go to any reputable laboratory, but you can send the results to me. But in that case, you have to be registered as our premium services member, and then I'll go to your result. But if you want to get your results reviewed free of charge, just go and do the test, okay, at our ATG laboratories in Lagos. And the laboratory address is already on the screen. So join there as soon as possible, okay? Let us check the question here on Instagram. Yeah, where's the laboratory in Nigeria? 4C Bay. The laboratory is in Lagos, okay? And the address will be put on your screen shortly, okay? Thank you, Alva Bold. Doctor, is it only in Lagos? Yes, we have 80 laboratory only in Lagos. 80 laboratories only in Lagos for now. Once we have fund and we have people supporting us, maybe we're able to open other laboratories in other parts of Lagos and the other part of Nigeria. But for now, we are only privately funded, okay? And that is through donations, through me, and through other sources we can to produce laboratory and to produce the IVF center. They are only in Lagos for now. As time goes on, with God being on our side, as always, probably we have a laboratory in China, in America, in London, in Italy, in Port Harcourt, Ghana, everywhere. Okay, thank you guys. God bless you. Let's move on. Must idosalpings be treated before IVF? Yes. If you have idosalpings, we have to treat it before IVF. Okay. Doctor, you said before transfer you will do vaginal swab. Please, what is the time frame before swab and transfer? Will this treatment not interfere with the IVF? No. Okay. We've given you medications, okay, to get your womb ready. Okay, doing swab in your vagina has got nothing to do to disturb your IVF procedure, okay? And that can be done at any time we think there's any offensive discharge, okay? Good. Thank you for that question. Sweet Gracia on Facebook, on Instagram. Doctor, what supplements can a 39-year-old woman take to have good quality eggs? Try DHEA, but I can't guarantee anything of that. DHEA can help to reduce the aging process of eggs, but it cannot increase the number of eggs. No, the number of eggs you have is given to you by God before you were born, and that is there for life. But to reduce and slow down the aging process of the eggs, you can try DHEA. Thank you. All right, thank you everyone for joining me today. I gotta go now. I'll see you tomorrow, and all by God's grace. I love you all, and thank you once again for all your compliments. God bless you. God be with you. My name is Dr. J. And by the grace of God, I'm here for you, and I love you all. And most importantly, I love myself too. God bless you. See you soon. Bye-bye.